You're listening to Dr. Mike Dadson, Ph.D. Counseling Psychology. Visit drmikeDadson.com if you'd like to ask a question of your own.
The thing that might impede change in the therapeutic relationship would be the failure of the therapist to be able to provide those ingredients to that particular person, which sometimes can happen because sometimes there's just not a match, and the therapist can try, but they, for their own reasons, not because of the client, but because of the way they're interacting with the client, the therapist is unable to maintain those elements within their relationship. It also could be that the client or the person seeking therapy, there's just a fundamental severing of trust that is not present when they enter into the room. So they have had a bad experience in the past, perhaps, or there's something about the therapist that activates in them memories that make it difficult for them to trust the person. So this would create a particular challenge for the therapist to overcome, to be identified, to overcome. But if the therapist is unable to recognize those things and overcome those barriers, that's going to make it very difficult for the person to enter into therapy. You know, in my training years, one of my first experiences when I'm doing my Ph.D. in counseling was a person who came in, and I went out into the waiting room and I introduced myself and I said, you know, I'm Michael Dadson. I'm really happy I get to work with you. Are you ready to come in for your session? And the poor lady looked at me wide eyes and stared and said, I was supposed to see a woman. I don't want to see a man. I've been hurt by men, and I specifically asked for a female therapist. So I said, well, I'm really sorry. I wasn't aware of that. There's obviously been a mistake. We're really happy, you know, we'll have you set up and we'll rebook you with another person. And she said, well, how long will it take? Because I waited 2 months to get this appointment at this center because it was a student center. So there's a long waiting list. And so I was honest. I'd tell her that I didn't know how long it would take and that it's possible she could be in for a lengthy wait. So she hesitated. She didn't want the wait. So I spoke with her a little bit more about, you know, understand it's really difficult for you to see a man, and I can respect that, and I'm very sorry for the inconvenience of it. She said, well, maybe I should see you. She went, maybe I should see you because I don't want to wait that long, but I have a lot of reasons for not wanting to see you. So I said, well, would you be comfortable coming into the office where we can talk in private and you can tell me all the reasons why you don't want to see a man, and I'll just listen to them, and we'll see how you react to that as I listen to them. And you know, you've committed, you're here for an hour, and if you're comfortable enough, I'll welcome you in, but if you prefer not, then I respect that too. So she decided to take me up on the invitation. She told me all the reasons why she didn't want to work with men, how she'd been hurt by men, her daughter had been hurt by men. And at the end of the session, she looked at me and she said, you know, you don't seem like you're that kind of a man. Actually, I actually feel quite safe with you. And it might be good for me to actually work with a man because it might help me learn that there are some men I can trust. So she decided to rebook with me and she came back for the next session. So that would be a place where her past experiences are getting, you know, very strongly or disrupting her ability to access therapy from for both genders. But, you know, I was able to kind of read it, respect it, and welcome her in, and we were able to overcome it together.